So I've been living the dream for the last 3 years, really, with regards to improving the mental health crisis pathway. And just to put it into local context, we've got about 2 million people in our ICS footprint, which supports about 8 CCGs in its entirety. We've got 4 Section 136 suites across our region, all geographically spread out, one which is for children and young people. And actually what we are trying to aspire to achieve is to really have the emergency department as being a never sort of event for somebody who needs to be there under Section 136, as well as trying to support our police officers. And as we all know, the Police and Crime Act changed in 2017 in December, which meant that we no longer had 72 hours to conclude a Mental Health Act assessment, and actually we had 24 hours, which for me was absolutely the right thing for the individual who's subject to, if their first time, is quite a horrific sort of experience, especially some of the Section 136 suites that we do have around our sort of areas. And the impact that then has on their families and their carers and relatives as well, especially if you're a young child. So we, as in Hampshire and the Isle of Wight, are very system focused, that actually we need to improve the system for everybody. And Mark spoke about is actually it's not just something that's going to support one provider to deal with their issues. This goes and supports the police, supports our ambulance, supports our emergency departments, and supports lots of different sort of providers. So we needed to proactively work with our partners to improve the system. And how do we do that? So I've talked a bit about what I think Bev would be saying from the AMP perspective, and obviously the changes that we needed to make. So we need to ensure that people's assessments were happening a lot quicker. We need to ensure that our Section 12 doctors were happy and compliant. So we did a survey on our Section 12 doctors to really understand their experience, what they wanted us to be able to help support them with. I think it's within our gift as commissioners to really help drive that forward. And the delays that people were then experiencing, how that affects our wider system. So if we've got blockages in our suites, it means people have to go to the emergency department, which therefore means we've potentially got officers on the street who are having to go and guard individuals in the emergency department because they can't be handed over to our Section 136 transport provider, which is just not the sort of right thing to do. And ultimately, we need to keep the patients at the centre of all of this as well. So we need to improve the efficiency within our system, and Section 12 solutions for me was how we were going to improve that. And actually what we can see from those is it's not just a local authority issue. So the efficiency savings that we have seen across our system are very much, as Mark has talked about, is that actually we're freeing up AMP time. So no longer is it taking me 4 hours to find 2 doctors or 1 doctor. And actually that means that I can probably squeeze in another assessment for another individual that day, or actually go out and do a community sort of assessment. We are freeing up our beds, so our Section 136 suites, which ultimately in turn is then freeing up our mental health provision. We are not using our emergency department as a health-based place of safety, which means that we are not having to have our ambulance or our police officers guarding individuals. And also our secure ambulance provider supports people in our Section 136 suites. They actually provide the supervision. So it means that they're not in there for as long as absolutely needed. And actually what we're seeing as a benefit to that is we are seeing assessments done within 6 hours. We are seeing people being able to be moved swiftly on in our suites, and we are seeing our AMPs increase the use of Section 12 solutions month on month, along with our doctors, who have increased massively as well. So as I spoke, we've had 55, we've now got about 105. And I think few of the key facts as well that I know Bobby will want us to talk about is that community and crisis funding, that we should ultimately be using that funding into recruitment. But actually, if we've got underspend, then we should be looking at how those digital solutions actually help us to improve that. And ultimately, that is a valid use of that spend as well. Winter is very quickly upon us, and actually we want to reduce the amount of individuals who are having to go to the emergency department subject to a mental health Act assessment. And actually, if that again is using some of that funding for Section 12 solutions, that's what we should be using that funding for. The Mental Health Act review absolutely looks at the digital sort of solution. So again, that's something that we need to be considering across our areas. And actually, the Mental Health Act, the Section 12 solutions cannot fit more perfectly in with all of the reviews that have been taking place. And we really need to think about how this is going to improve Section 12 doctors and the efficiencies that they're seeing and the benefits to their whole work-life balance that I know Dr. Adam Cox, and I'm hoping, is going to talk about. Beth has managed to get Adam on the phone, so I'm hoping the linkage is going to work. If not, I know Amy is going to add to Dr. Adam Cox's slide. So Amy is more than welcome to share my email address with any of my commissioning colleagues across the areas if they want any advice, any feedback, me to share any business cases or any data privacy impact assessments. If anybody wants any help, I'm more than happy to offer that sort of help to you.